She has a homocystine of 6.9, and she has a sulfate 5-day average. She had one day that was 400, one day was 1200, and the other three were 800. So she seems to have a little bit of sulfur reactivity, but for the most part, she has pretty well balanced sulfur. So her, if her homocystine is 6.9 and her urinary sulfate is right in the middle of what's considered normal, I don't think that she needs to go through a low sulfur diet. With a homocystine of 6.9, I wouldn't give her a lot of B6 because B6 is going to drive her homocystine down a little bit. I don't know that I would want to see her homocystine go down. If you ever felt like she needed B6 for neurological issues, I would give B6 with L-methionine because her homocystine is good where it's at. I don't think she needs to focus on lowering her homocystine. And so, she also does not, because her homocystine is 6.9, she's not going to need a large dose of 5-methylfolate. Okay. Remember this diagram with fatty acids. Remember that fatty acids, the diacid forms of fatty acids can be produced by peroxisomes from gut bacteria. And typically when we see high levels of the diacids, it's a sign that fatty acids are not being transported by the carnitine shuttle. What I would prefer to see in any patient is a high level of fatty acid metabolism through beta oxidation in the mitochondria, meaning that they have good mitochondrial function. And remember that the downstream metabolite of fatty acids, beta hydroxybutyrate, is one of the ketone bodies that we want to see when fat metabolism is the primary source of energy in the human body. What we see with this patient is she doesn't have a high level of adipate, but her subrate's a little bit high. Her ethyl malanate's okay. What my concern with her is her lactate. Flagged high lactate with non-detect beta hydroxybutyrate tells me that she is in what I would call the Warburg state. She is relying mostly upon anaerobic glycolysis for her energy, and that is a state of low mitochondrial function. Not good, especially for a 30-year-old. I would be worried if that were me. And so remember that when the mitochondrial pathways are downregulated by insulin in particular, the high glycemic diet causes high insulin and low mitochondrial function. Remember, oxygenation is also a critical factor here. Remember, the whole point of the TCA cycle is to feed electron transport. If electron transport is downregulated because of poor oxygenation, that is also going to get the sad mitochondria face. And I don't think I have to tell you how much I dislike the sad mitochondria when I see high lactate. So anything you can get this patient to do to lower her sugar intake, to breathe more, to get more physical activity. I mean, just remember, this is why meditation and yoga are so important, because when you're meditating and you're focusing on your breathing, you're breathing. There are too many people that are shallow breathers that don't even use their diaphragm to breathe. They're afraid to let their belly stick out when they breathe, and so their posture makes them not breathe completely. We need oxygen. It's the only way that we can be inspired. No pun. So, when we look at her TCA cycle, she has some high markers. High citrate can simply be from downregulated enzymes from insulin and the anaerobic state. But high citrate can also be related to issues with the urea cycle. If she is running high ammonia, that can be a contributor to high citrate.